Hello, my name is Jean Armand, and welcome to the Health Flow podcast. That's right, you heard it, the Health Flow podcast. I'm a nurse practitioner, and I have a passion for our health. I want you to know more about your health so you can make better decisions about your health. So, the Health Flow podcast is created to help you to understand your health, take care of your health, and to navigate the healthcare system. I'm your host, Jean Armand, and I'm a certified nurse practitioner with a bachelor's degree from Seton Hall University. My master's degree is from Rutgers State University, and I have additional certifications that I obtained from Emory University in Atlanta, Georgia, where I currently live. I'm a mother of three wonderful young adult children, and I still work daily. I work as a nurse practitioner. I think the place that I've worked the most as a nurse practitioner, the area I should say, is in emergency room. I enjoy the emergency room. I enjoy the variety of patients that we get to see, the variety of illness, the different personalities, the challenges that we face, and the rewards that we get when we are able to diagnose and treat and save a person's life, and just clear up any complaints that they have. It has been a rewarding career. I enjoy it. I really do. Some of the challenges are that, and what even brought me to this idea of the Health Flow podcast, is that really I see my coworkers see that there's a lack of understanding that exists, even with all the wealth of information that's out there. Um, Patients aren't always able to uh, relate and understand that information to their specific problem, their medical issue. So, and it is really our responsibility, the healthcare team responsibility, to give as much information as we can. And some of us do a really good job, and some of us don't do a really good job because not everyone has that ability to speak at the level that the patient can understand. And sometimes it is also the times that we're given to explain these conditions and treatments to patients where they're in a stressful situation. All this is new to them, and here we are throwing all this information to them. And by the time they get home, they really can't even remember what was said. And yes, the healthcare team has gotten better with making sure we give written information, but even with all that, the medical field is complicated, and I want to uncomplicate it by sharing as much information as I possibly can on common and not so common medical conditions to make it plain, make it clear, increase your knowledge so that you can be more comfortable with navigating the healthcare system and taking better care of your health and living your best life. That's what the Health Flow podcast is here to do. Make it plain and make it simple for you. Join me, why don't you? So, this is what we have lined up. I plan to have weekly podcasts. You can join me every Tuesday. I plan to send out those podcasts and so you can listen. I plan to have to talk not just from my personal experience, but I've already have a list of guests set up. We'll have a list of topics already set up. We're going to talk about breast cancer. We're going to talk about autism. We're going to talk about lupus. We're going to talk about high blood pressure, diabetes, prostate issues, sexually transmitted diseases. And you, my audience, will have an opportunity to email me topics that you'd like to hear about or just DM me on Instagram. So you can follow me on Instagram, where I'm going to be posting health tips several times a week. You can email thehealthflow@gmail.com and send me your questions, send me topics. I look forward to sharing with you. I look forward to increasing your knowledge about your health. I look forward to just walking this walk with you, getting you more proactive and excited about your health, treating you right, living your best life, giving you the knowledge that you need, uncomplicate the complicated healthcare system. Make it simple so you can understand and you can treat and help yourself the way you should. The Health Flow podcast. Once a week on Tuesdays, I'll release a new episode so we can learn and live our best life. Thank you for listening. The Health Flow podcast. See you soon. So I just want to clear up some small differences between some of the people you may come in contact with while navigating the healthcare system. For example, obviously, we know who doctors are. Doctors have undergone extensive training. They have an undergrad degree. They've completed 4 years of medical school. Then, in addition, anywhere from 3 to 7 years of residency training, depending on the specialty that they elect. Nurse practitioners, NPs, mid levels as they call us, are we're trained, we're masters. We have a master's degree, so we have an undergrad, master's degree. We're trained using nursing models. We look at a patient holistically. We look at we consider the patient's mental and emotional needs along with their physical problem. So a nurse practitioner, we order laboratory tests, diagnostic tests, we diagnose illness and diseases, and we prescribe medications and develop treatment plans. Physician assistants or PAs, they do the same things that nurse practitioners do, but their training is from the medical model. Their training places a greater emphasis on disease pathology. They approach the patient care by looking primarily at the anatomy and the physiological systems of the body. Choosing a healthcare provider is really independent on the patient comfort level with the provider's knowledge and the patient's ability to develop a trusting relationship. So, you know, I just wanted to make that clear because I mean, there's been plenty of times that, I introduce myself and say I'm the nurse practitioner, and patients aren't really familiar about, they hear nurse, so a nurse is a nurse. Yes, we're nurses first, but we are nurses with extra training, and we our experience, and we're able to assess patients, diagnose them, and treat patients holistically. The and that's the main difference. We can, depending on the state that a nurse practitioner practice in, we can also, I mean, we work in collaborations with physicians, but some states do allow nurse practitioners to be independent providers. Thank you for listening to the Health Flow podcast. Once again, I'm your host, Jean Armand. Join me weekly for new episodes. You can follow me on Instagram at The Health Flow, and flow is spelled FLO. You can also like us on Facebook, and you can feel free to send me an email at thehealthflow, FLO, at gmail.com. Send me your questions or any topics that you'd like to learn about. And I just look forward to sharing with you. Thank you and have a great day.